Thank you so much, everyone, for joining us today for the COVID-19 Appendix K additional CMS guidance on retainer payment and reimbursement. I am Rebecca Duggar, and I am joined by Catherine Ivey as well as Ashley Caseman with DBHDD. And today we will be going over some very important information as it relates to retainer payment and reimbursement. Next slide, please. Again, we are joined by our partners at DBHDD, Ashley Caseman, and we do ask that if there are questions specifically related to the Department of Behavioral Health and Developmental Disabilities NOW and comp waiver programs, that you direct those questions to our partners, and they'll be more than happy to provide those answers to you. Next slide, please. So we always begin with the mission of the Department of Community Health, and that is to provide access to affordable, quality health care to Georgians through effective planning, purchasing, and oversight. And so again, we'll go a little bit more into the oversight portion, and we hope that this will address any of your questions and concerns. Next slide, please. So today's objectives will be as follows. We'll review the CMS FAQs posted as of June 30th, 2020. We'll discuss operational processes in response to the guidance posted at that time, and then we'll also provide information on attestation of reimbursement, duplication avoidance. Next slide, please. So we always begin all of our webinars and discussions with a bit of a disclaimer, and that is the recording of this discussion is a snapshot in time. And due to the rapidly evolving nature of the emergency, additional information and implementation plans will be provided through FAQ pages, banner messages, and other published information. Now you can find the latest COVID-19 guidance, including the Appendix K application and amendments, on the Georgia Medicaid website at medicaid.georgia.gov/COVID-19 or dchgeorgia.gov. Next slide, please. And so our agenda will be as follows. We'll look at the new CMS guidance on reimbursement of retainer payments. We'll discuss examples of the retainer payment and implementation and what that should look like for respective providers, as well as give you some information on overpayment options and what happens when that occurs. As well as what's new is an attestation documentation and the avoidance of duplicative reimbursement. And so we'll go into a little bit more detail with that. We'll also provide you with information to provide questions and so forth. So now I'll turn it over to Catherine Ivey, who will go over a little bit about the CMS FAQ document. Catherine?
Thank you, Rebecca. Good afternoon, everyone. We're so pleased that you could join us for this recording because we have some very recent information from the Centers for Medicare and Medicaid Services in the form of an FAQ document. That document was posted on the CMS website on the 30th of June, and we've given you the citation so that you can go and look at that yourself, and we hope you will, because we have reviewed the FAQ document very carefully, but we really want you to review it yourselves and make absolutely sure that you understand the very latest guidance from CMS. Okay. This is just a reminder that the retainer payments, which is 100% what this particular webinar will be dedicated to today. This is all about the retainer payment with regard to the approval of the waiver Appendix K applications. There were certain services that were designed in the Appendix K applications to be eligible for retainer payments. In the elderly and disabled and ICWP waiver programs, that included personal support services. A similar service that's provided through the NOW and comp waiver programs is community living support. And so those two services are in those 4 respective waiver programs. We're eligible for retainer payments. Adult day health care in the elderly and disabled and ICWP programs, which is synonymous with supported employment services, pre-vocational services, and community access group services in the NOW and COMP programs, only because all of those are provided as a day service only. Alternative living services in the elderly waiver and the ICWP, which is the same thing as community residential alternative services in NOW and COMP. So those were the only services that were approved by CMS in the Appendix K as eligible to receive retainer payments. Okay. The retainer payment guidelines for all states is what we've highlighted here, and we picked out certain elements of the guidelines as were posted in the CMS FAQ page that were specifically addressing questions that we had gotten previously from providers. Some providers sent us questions saying, it appears that personal care services are the only services eligible to be able to receive retainer payments. And we are an adult day health center, or we are a community access group center. And so we're not quite sure that this is applicable to us. Well, CMS addressed that as part of the FAQs, and they did highlight specifically that personal care services would be a component of any HCBS service which was eligible for retainer payments, but that there were typical day service programs, day programs providing services that would offer personal care as a component of the service. And so those were eligible as well, which is why we included supported employment, adult day health care, pre-vocational services, and community access group services. Okay. The retainer payment guidelines for all states, as you recall, and we've mentioned this in previous slide presentations and webinars, the length of time that CMS allowed states to apply for retainer payment reimbursement was for the lesser of either 30 consecutive days or the number of days for which the state authorizes payment for bed hold in nursing facilities. Just as a reminder, Georgia has for many years, in fact a couple of decades, included a bed hold policy for nursing facilities that allows 7 days of reimbursement should someone leave a nursing facility to go to the hospital or leave the nursing facility for any reason. But typically in nursing facilities, it's for hospitalization. Despite that, Georgia submitted a retainer payment request from CMS for 30 days, 30 consecutive days, as the state's request for retainer payment reimbursement, because that was allowable. What CMS said on the 30th in their FAQ document was that states may authorize up to 3 episodes of retainer payments. But remember that the 30-day episodes are payable if the state's bed hold policy is allowable for 30 days. CMS notes that a state can set the rate for retainer payments at either the same rate that the service would actually bill on a regular basis or a percentage below the full rate, but Georgia decided to request the full rate for the service under retainer allowances. Furthermore, consecutive days, CMS defines in the FAQ document, are those days that are eligible for billing. So, for example, if a typical day habilitation service or adult day health service is rendered Monday through Friday only, not on the weekends, then 30 consecutive days could actually encompass a 6-week period of time. Next slide, please. Thank you. This slide we included because this slide was included in previous webinars, but we have corrected guidance based on the FAQ page that CMS just released a couple of weeks ago. It discusses retainer payments. And in the previous webinar, we said if you look at the highlighted portion at the bottom of the screen, services can be reimbursed as a retainer payment for 30 continuous days initially. And what we said previously was, and in increments of up to 7-day spans following a date of service delivery. We have actually had to modify that and indicate, as it states in the retainer payment, that up to 2 additional 7-day spans is all that's allowable. That's what is specifically included in the FAQ page, is that only up to 2 additional 7-day spans are allowable for reimbursement of retainer payment. Next slide, please. It also imposes mandatory state controls on reimbursement of retainer payment. Specifically, states that use and have been approved to use retainer payments for multiple episodes, up to 3, as per the FAQ, would be expected to include the following guardrails in their Appendix K submissions. They must limit retainer payments to a reasonable amount. They must ensure the recoupment if other resources, once available, are used for the same purpose. We're required to collect an attestation from the provider acknowledging that retainer payments will be subject to recoupment if inappropriate billing or duplicative payments for services occurred. We're also required to receive an attestation from the provider that during the period that it's receiving retainer payments, that the provider will not lay off staff and will maintain wages at existing levels. Next slide, please. Also, additional mandatory state controls for reimbursement are that we must collect an attestation from the provider acknowledging that the retainer payments will be subject to recoupment if, in fact, the provider has received funding from other sources that would exceed the revenue for the last full quarter prior to the public health emergency. Let's go into that just for a minute, and Rebecca's going to talk about that later on with some specific questions that we received in an earlier webinar. But essentially what CMS is saying is that for the quarter, the full quarter immediately preceding the public health emergency, which would have been the quarter spanning from October through the month of December of 2019, that your revenue from the period from the quarters within the public health emergency can't exceed your ordinary revenue. So in other words, what CMS is saying to providers is, you can't have benefited from the multiple fund sources that are available for providers during the pandemic, during the COVID-19 public health emergency. So if, for example, your staff were receiving unemployment benefits, or you received funding through Small Business Administration loans that may not be repayment, there may not be repayment required. Or if, in fact, you received provider relief funding through the CARES Act, that it can't exceed the total revenues of all of those fund sources cannot exceed your revenue from doing business ordinarily as you were doing in the months from October to December. You've also got to attest that retainer payments at the level provided by the state wouldn't result in the revenue exceeding that quarter prior to the PHE, just as we've mentioned before. So look at all of the fund sources that you are able to pull down during that first quarter and then subsequent quarters during the public health emergency, and make absolutely sure that your total revenues didn't exceed your ordinary revenues that you would have pulled in from just billing as usual. Next slide, please. So providers are subject to recoupment if inappropriate billing or duplicate payments for services occurred. Note that duplicate uses of available funding streams means using more than one funding stream for the same purpose. So if in fact you were pulling down funding streams to pay your facility rent and your payroll and various other operating expenses and billing retainer payments at the same time, that would not be allowable. Next slide, please. And so what can providers do if they've billed in excess of 44 days of retainer payments? Because remember, we were approved for the first 30 days of reimbursement, and that's billing days of reimbursement for retainer payment, and then 2 subsequent 7-day spans. So it's 30 plus 7 plus 7, or 44 days total. What if you've already billed for more than 44 days? What if you've billed for 45 or more? There are a couple of different ways that you can handle this. You could void the claims that represent the 45th day and beyond of retainer payments, or take a look at Part 1, Policies and Procedures for Medicaid and Peach Care for Kids, in Part 407, which is titled Recoupment for Reimbursement, and you can submit a request for a repayment plan that's described in that section. Next slide, please. Okay. So then there were questions about how providers are going to submit this attestation. DCH is developing right now a web-based fillable document that will be available on the DCH website for all providers who have billed retainer payments. In future banner messages and in future DBHDD special bulletins, we're going to provide a link to be distributed through professional and trade associations and via banner messages, special bulletins, so that everyone has access and knows where to find that web-based fillable document. It will in fact include all of the attestations that we've mentioned in previous slides about, for example, services that you've received so far, about your staff members receiving unemployment benefits, etc. And you will simply attest that you have not violated any of those rules. And Rebecca, would you like to take the next slide? Let's see what we're looking at now.
The next slide is actually for Ashley, if she could speak to the DBHDD operational guidelines.
Thank you.
Thanks, and thanks, Rebecca. Yeah, this slide links now and comp providers to the DBHDD operational guidelines, which were actually just last updated today, July 13th, to reflect the retainer changes detailed in this webinar, as well as the CMS FAQs. Thank you.
Thank you so much, Ashley. Next slide, please. Yes, thank you. So we knew that you all would have several questions. So some of the initial questions that we included in the slide presentation are as follows. Do you need to complete an attestation for past retainer payments that you might have received from mid-March until mid-April? And the response is yes, you do need to. If you've received retainer payments at all, you will need to go ahead and submit an attestation, complete the attestation form. Then we thought you might have questions about, do you have to complete one every time you submit a bill? And the answer to that is no, just one time. And can you bill retainer payments such as those that are intermittent with service delivery? So I'll remind you that in previous webinars, we advised you, and because we thought that this was, and it was the advice of CMS initially, that in order to bill subsequent retainer payments, you would need to deliver a service in between those spans. That is not the case any longer. After the FAQs were published on the CMS website, we had a conversation between DCH and CMS just to make absolutely certain that we were sure of the intent of the FAQs, and they said that while they thought it was a really good idea that there would be intermittent service delivery, they wanted to take that back to their leadership because retainer payments really were meant to be billed in spans, in consecutive spans of a total of 44 days. So you do not have to have provided a service, even through telehealth, in order to bill the second set of retainer and then the third and final set of retainer spans. Then we thought you might ask, since DCH has corrected the calendar, our first thought was that it applied to calendar days versus business days or approved ISP days. Can you go back and add those days to the billing days? And the answer to that is yes, up to 44 days. So if, for example, an individual attended your center on Mondays, Wednesdays, and Fridays, that would probably take you to a full 8 to 10 weeks of billing, because those would be the billed days that you would actually be able to bill a retainer payment, up to 44 total. And finally, CMS has been very clear with us verbally on the phone when we were getting information, and then also in writing, that CMS has said there will definitely be audits following the public health emergency. Next slide, please. Rebecca, why don't you take some of these questions that we received earlier?
Sure, thank you so much. Again, these are questions that we received in a previous webinar with providers, and we thought that these might be very helpful as you continue to try to understand the guidance that has been placed out there. And so the first question is, the attestation asks to attest to no duplicative payments, but PPP or PRF cover 100% of expenses. So how do we attest when funds received did not cover all expenses? And so again, our response to that is that please note that duplicate uses of available funding streams means using more than one funding stream for the same purpose. And as we said before in previous slides, that certainly means that if you have drawn down funds for operational costs, salaries, rental for your space and so forth, and you've done that for each loan or other funding stream, that is going to be a problem for you. So certainly it is for the same purpose when you are drawing down those funding streams that we want to make sure providers understand that you cannot do, okay? And so can we delay retainer payments and use once PPP funding has been exhausted? So again, if a provider had not already received revenues in excess of the pre-public health emergency level, but receipt of the retainer payment in addition to those prior sources of funding results in the provider exceeding that particular level, then any retainer amount in excess would be recouped. So again, if a provider had already received revenues in excess of that pre-public health emergency level, then retainer payments are not available. Again, we are not telling you how to use those resources. It is very important that they not be duplicative and that they not exceed your pre-public health emergency level, again, for the quarter of October through December of 2019. Next slide, please. And so another question that we received is, can we bill retainer payments up until the date PP loan funding was received? For an example, we closed centers and began sheltering in place on March 16, 2020, but did not receive PPP funding until April 22nd. Can we bill retainers for the period in between, or does the previous quarterly revenue standards apply to the first and second quarter this year, as we are still not in full operation? Again, providers can bill for retainer payments at any time, beginning of March 1st, 2020, until the 44 billable days have been exhausted. Again, providers cannot bill for duplicative services already captured by other funding streams, as we previously noted. and all funding received for services must not exceed those levels, and we can't say that enough. Again, please adhere to those dates and be very mindful of your 44 billable days that you have been allowed to do. So, if we acted in good faith based on guidance received at the time and billed retainer payments, but we're now being asked to complete an attestation stating we will abide by requirements we were not aware of at the time of billing, are we subject to recoupment? And the answer is yes. All providers that have billed for retainer payments are subject to audit and possible recoupment of received revenues in excess, again, of those pre-public health emergency levels. So it's very important that everyone understands that. And so we always have plenty of questions, and so we do have a dedicated COVID-19 email box that has been established. That's at medicaid.pckcovid19@dch.georgia.gov. And we also have resources for reopening non-emergency healthcare facilities. And that information can be found at www.dch.georgia.gov on the Department of Community Health main page dated June 9th of 2020. And so I'll turn it back over to Catherine for any final thoughts, and again with contact information. Catherine?
Yes, thank you, Rebecca. We do want to go ahead and stress one more thing with you. There was an excellent question that came into the previous webinar that we had this morning, and it was, what if my agency has received a loan that requires repayment? Remember that the audits will come into effect after the public health emergency. They certainly will not begin during the public health emergency. And so if your revenue stream was boosted for a short period of time, but those loans have to be repaid, just know that it is your final revenues that will be subject to review during an audit. I just wanted to mention that because several of you have entered into loans that require repayment, and you certainly would not be held liable for a temporary boost in revenues based on that. The final thing that I wanted to say about something that we posted called Resources for Reopening Non-Emergency Healthcare Facilities is that none of what we've provided to you this afternoon in this webinar should be construed as an endorsement that you reopen your centers. We certainly cannot, we can't advise you to do that. We know that each of you are really struggling as businesses and trying to figure out what the right thing is for your population and for your particular business and your agency. We do want to encourage you, though, that if members are wanting to come back, if they're willing to come back, that you pay very close attention to all of the information that we've posted in this reopening section on the DCH website, because there's information from the Department of Public Health, the CDC, and then finally there's some good information from CMS itself on reopening non-emergency healthcare facilities. So if you do decide to reopen, just know that each individual member will have to decide for him or herself whether or not to attend a group setting, and that you will be held responsible for reopening your healthcare facilities in a way that's really as responsible as you possibly can achieve. If we could get the last slide, please. There we go. We wanted to just point out one last time the dedicated DCH email box for additional questions, and also the site where Now and Comp waiver program information can be found. You can contact the DBHDD Provider Relations team. Do you want to say a last word about that, Ashley, in terms of sending information?
Thanks, Catherine. Yep, most of our providers are familiar with PIMS and contacting the Provider Relations team if they need any additional information, and the link attached to this slide directs the provider to where they can ask the question to their Provider Relations team, and they always loop in the subject matter expert on questions if they need any additional guidance.
Thank you, Ashley, and thank you, Rebecca. I guess the last thing that we'll close with is this is an evolving situation. That just know that please, please, please watch banner messages, watch the MMIS website, watch the DCH website and the DBHDD website, because just this morning we received word from CMS that in order to secure and be assured of the 2 additional spans for reimbursement of retainer payments, the additional 7 days and then the third 7-day span, we have got to submit an Appendix K amended application. We'll submit 2, one for the now and comp waiver programs and one for the elderly and disabled and ICWP waiver programs. And so we've got to do that and resubmit it to CMS in order to provide them credible assurance that we will be maintaining the standards of reimbursement that they have required through the attestation section, and to ask their permission to go ahead and allow the 2 additional spans. We were not clear about having to do that until they emailed us this morning, so we'll be submitting that by the end of the week this week. But do please pay attention to your professional trade associations, your banner messages, the DBHDD website, because it's our best way to communicate with you if something should change. Thank you very much. Thank you for joining us for this presentation, and we will certainly submit any additional information as quickly as we can get it. Thank you.